A chunk of shrapnel ripped through his helmet and cracked open his skull, exposing his brain to the entire battlefield.
Wow, that's crazy.
It should have killed him instantly, but the shrapnel missed every critical part of his brain, and he just kept fighting like nothing happened.
That's hard to believe. There was no blast injury to the brain, or some spicules of his skull went into his brain. So sometimes what happens with the skull, you break off part of the skull and part of the skull goes in and damages the brain. This is a crazy story. I'm sure it probably happened, but man, is this guy lucky to be alive.
When he got back to camp, surgeons patched up his skull, and he lived for 20 more years.
That is an amazing story.
If you fire a bullet at a fake silicone implant, most people think it would stop the bullet from reaching vital organs.
That's never going to stop a bullet. I do a lot of breast augmentation, and although the implants, you can jump on them, you can pounce on them, you can punch and they won't break, you can easily jab a knife right through it very easily.
But implants are made of silicone gel and can only be as big as a volleyball, which is enough to slow the bullet down, but not stop it completely. So if you fire a low caliber round, you'd need about 6 implants in a row to stop it.
Probably even more than that. They're not bulletproof, that's for sure.
A doctor would drill a hole in your head if you had a really bad headache 500 years ago. They would begin by shaving the area, then use a hand-operated tool to start drilling into your skull.
This is actually true. This really happened. It was called trepanation. It just never really worked.
Some of these doctors believed this would allow evil spirits to escape through the hole. In reality, the procedure had a very low success rate and probably just caused more pain.
Thankfully, with the advent of modern medicine, that's not performed anymore.
After eating the fish, her lips, fingers, and feet turned black, and she was rushed to the hospital. Doctors discovered she'd contracted a rare flesh-eating bacteria. As the infection spread, her kidneys failed, and her doctors put her into a coma.
This is a thing. There is some bacteria in uncooked fish. It's called Vibrio vulnificans, which can cause this.
But she kept getting worse. Finally, the only way to save her was to amputate all 4 of her limbs.
This is really horrible. This comes from consuming raw or poorly cooked seafood, especially in clams, oysters, or other shellfish. They have an increased risk of Vibrio vulnificans entering the body.
A woman suddenly lost consciousness while a fake doctor was performing an illegal laser treatment on her. And instead of taking her to the hospital, he shoved her body into a suitcase. He left this suitcase in his garage for weeks while her family and police searched for her.
Unfortunately, this happens. There are a lot of fake doctors, and because he was a fake doctor and she lost consciousness, he didn't know what to do. That's part of the problem. There are people disguising themselves as doctor out there. This is really horrible.
The bullet was shot at the car, shattering the glass before hitting her in the head. But somehow she stayed conscious as blood poured down her face. She was rushed to a hospital where doctors discovered the bullet lodged into her hair weave. You see, the tightly woven fibers had cushioned the impact on her skull, causing the bullet to bounce back out. And after being treated for her injury, she made a full recovery.
But some of these hair weaves are so thick and so tight, I can see how that would cause like a cushion like that and block some of the entry. When you get hit in the head, you can have a coup or counter coup injury, which can cause bruising on the brain, even though it doesn't penetrate the skull.
If you lose your hand, a doctor will stitch up the wound and you'll have a stump. But if your blood vessels and nerves are in good shape and the conditions are just right, you might have another option. You see, a doctor can take a hand from a donor and meticulously connect the bones, veins, and muscles to your arm. If done correctly, you'll have full control over your new hand, and the skin is stitched to your arm.
You have to take a lot of anti-rejection medications that you would be on for the rest of your life to reduce your immune system so your own immune system doesn't attack the foreign hand that's there. But this is a surgery done. It seems to be very successful. How much function they get, I don't think it's 100%, but they get significant function back, and it can significantly change someone's life for the better. better.
He stuck a Lego piece up his nose, and it got stuck. So he shoved a different piece in the same nostril because they connected together, and he thought it was a smart way to remove it. But instead, both pieces ended up getting stuck. His mother pulled out the bigger piece, unaware that the smaller one remained deeply lodged inside.
This is a rare story, but very possible. But if any foreign object gets stuck up your nose and you get it out with a tweezer, okay, she was very gentle, she didn't cause any damage, but she really should have her child evaluated by a doctor to make sure everything's okay and there was no damage formed.
For 26 years, he struggled with congestion, asthma, and sleep apnea without realizing why. Then, one day, while blowing his nose in the shower, the Lego piece suddenly popped out after 26 years.
It's hard to believe it didn't cause him more problems than that. Sometimes it can cause chronic infections, erode through the tissues of the nose, causing severe problems.
The parachute released, but for some reason it didn't open, and she fell over 3,000 feet with the tangled parachute trailing behind her, blacking out on the way down. She crash-landed, breaking bones, including her spine and even her tooth.
Probably good she blacked out, because that would have really hurt. She must have been in a lot of pain when she woke up. I can't believe she survived that. The parachute must have opened enough to cause some resistance so it wasn't a complete free fall. This is a bizarre story, and she's really lucky to be alive.
She was rushed to the hospital where doctors tried to stop the internal bleeding, but miraculously she survived, and 5 weeks later she was walking again.
Wow, that's crazy. I bet though she has some type of ambulatory problems that's going to plague her whole life. She's just lucky to be alive.
A doctor drilled a needle into a woman's arm to save her life, but when they tried to pull it out, it wouldn't move. An x-ray showed the needle had bent deep inside her bone, like a twisted paperclip. The woman was dangerously dehydrated and needed the needle to pump fluids into her body. But now surgeons had to carefully pull the bent needle out piece by piece without breaking it further.
This is something that's rarely ever done in adult. I've actually never heard of it done in adult. It is done in pediatric patients where basically they need large IV access and they can't get any IVs in because children's veins and arteries are much smaller. So they do what's called an interosseous IV where they do that, but it's usually below the knee and the leg. And then once that's successful, you can pump large volumes of fluid in and save the child's life.
During surgery, they removed the wrong foot. This happened because the man's paperwork mistakenly listed his left foot as infected when it was really his right. And when he went in for surgery, the healthy foot was marked. He woke up and realized that he had lost the wrong foot, meaning he had to go through surgery again to remove the right one.
This is something that you hear about, rarely ever happening, but wrong foot amputation, wrong side of the brain being operated on. You always go through multiple checks with this. You always ask the patient as well, mark the area, multiple people see it, and it's real unfortunate that this still happens.
This procedure begins with a doctor taking a piece of your tooth and creating a prosthetic lens. And it's performed on patients who have a disease on their cornea that causes it to become opaque. This blocks light from reaching the retina, causing them to lose their vision.
So this is actually something that's really done in rare cases when you have a lot of damage to your cornea. It's called osteoodontokeratoprothesis.
To fix this, a doctor will take the makeshift prosthetic lens and implant it into your cheek. This allows blood vessels to develop inside that will keep the tooth lens alive. And after several months, this tooth lens acts as a new clear window through which light can enter your eye.
So some of the tooth is taken with the surrounding bone or ligament. The hazards are it's multiple procedures and there's a risk of infection.